you have to define what is bronchiectasis, etiopathogenesis, morphology, clinical features, and complications. We are going to do top 50 questions. Okay, so see here, bronchiectasis के लिए आगे बढ़ते हैं. Okay. Okay, so bronchiectasis, it belongs to chronic obstructive lung disorders. Okay, so chronic obstructive lung disorders, these are what? These are of different types. Okay, so the obstructive diseases, the FE1 is less than 80, FEC is less than normal, or FE1, FE or FVC ratio is less than 0.7, and total lung capacity is normal or either raised. Okay, so there are different types, like we have emphysema. We have what? Emphysema is what? Disorder of acinus. The functional unit of lung is affected. So imbalance between elastase from WBCs and anti-elastase, that is antitrypsin, alpha 1 antitrypsin, alpha 2 microglobulin. So there is a imbalance between elastase, there is an imbalance between the elastase and the alpha 1 antitrypsin enzyme. Okay, two important etiological factors include smoking. Overall commonest cause is alpha 1 antitrypsin deficiency, that is para-acinar emphysema and micronodular cirrhosis. The two important etiological factors include smoking is alpha 1 antitrypsin deficiency and para-acinar emphysema and micronodular cirrhosis. Normal gene is PIMM, whereas misfolded protein is PIMZ. Heterogeneous gene or PIZ, homogeneous gene defect. Air pollution and pneumoconiosis can also increase damage. So there are different types of emphysema, centri-acinar emphysema. Clinically most important emphysema is the centri-acinar. Most common causes of smoking, upper lobes affected with sparing of alveoli. Okay, sparing of alveoli, sparing of alveoli. Okay, sparing of alveoli. So first is centriacinar, second is what? Second is paracinar, second is what? Paracinar, second one is paracinar. So whole acinus involved due to alpha 1 antitrypsin deficiency base of lungs. ज़्यादा ही पतला नहीं हो गया. It is associated with micronodular cirrhosis with autosomal resistance inheritance. Distal acinar emphysema is more common smoker associated with spontaneous pneumothorax due to blood formation upper lobes of lungs. Irregular emphysema, patchy involvement. Most common causes irregular. Most common microscopic is irregular emphysema. Clinical features due to tendency of alveolar collapse. Clinical manifestation. Talking about chronic bronchitis, so these emphysema patients, they are called as pink puffers. They are called as pink puffers. These are called as pink puffers. Why these are called as pink puffers? Why these are called as pink puffers? Because what happens here? These patients, due to tendency of alveolar collapse, clinical manifestation include dyspnea, most common, difficulty in breathing, others like weight loss, pursed lip, breathing, and features of air trapping, flat diaphragm, barrel chest. Okay, so these are called pink puffers because they can take the air, but they cannot put it out because there is a tendency of alveoli to collapse. These are called pink puffers. Next is chronic bronchitis. Presence of productive cough for duration of at least 3 months for 2 consecutive years, then only you can call it as chronic bronchitis. Smoking is major cause. It is seen in smokers. Clinical features like there is a productive cough, fever. This is the features of chronic bronchitis. Okay, itis means inflammation. There's a productive cough, fever. So patients are known as blue bloaters as they don't maintain oxygen saturation. So their oxygen saturation is decreased because these patients, because of the whole inflammation and all, the oxygen cannot reach the alveoli. It cannot diffuse from the alveoli blood. So high risk of right-sided cardiac failure due to pulmonary hypertension will be there. So more increase of right-sided heart failure. So microscopic increase, there is increased redex index. Read index is very important, and squamous metaplasia progressing to cancer may be seen. And COPD patients have increased longevity with oxygen inhalation. Histology shows airways remodeling. Airways with remodel. There is a squamous metaplasia. So columnar pseudostratified columnar epithelium is replaced with the squamous metaplasia. Squamous is called squamous metaplasia. Okay. Talking about bronchial asthma. 1 minute, I'm coming. Hmm. Talking about bronchial asthma. So in bronchial asthma, there is a reversible airway spasm which can be extrinsic and intrinsic in nature. If there is extrinsic asthma, then what will happen? There is extrinsic antigen, dust or pollen. There is a type 1 hypertension and increased IgE. The children with history of eczema or atopy. Intrinsic asthma, viruses, cold, exercise, occupation, NSAIDs. So there is aspirin. Normal IgE levels, adult onset. Okay, talking about Samter's triad, aspirin intolerance, asthma, and adult nasal polyps include wheezing, nocturnal cough, and respiratory alkalosis dyspnea. So Samter's triad is aspirin intolerance, asthma, and adult nasal polyps. Polyps are there here. Okay, so talking about the asthma. So in asthma, there is intrinsic asthma and extrinsic asthma. In extrinsic, there is eczema with the atopy, dust or pollen energy. Intrinsic means from inside, like due to NSAIDs, like aspirin, or due to even the normal IgE levels are there. Then also the patient is having symptoms of asthma because of a viral infection or cold or exercise or occupation. Okay, so that is so Samter's triad. It is having aspirin intolerance, asthma, and adult nasal polyps are there. That is Samter's triad. So clinical features include wheezing, nocturnal cough, respiratory alkalosis, and dyspnea. डायग्नोसिस स्पाइरोमेट्री बेस्ट रहता है स्पूटम एग्जामिनेशन चार्कोट लेडन क्रिस्टल क्रशमैन स्पाइरल्स एंड क्रियोला bodies. So if you see in the spirometry test, you will get the absolute diagnosis of asthma. But if you can't see, then you have to go for sputum examination. If you see the charcoal laden crystals, these charcoal laden crystals, these crystals, if you are able to see charcoal laden crystals and Crushman spiral bodies this Crushman spiral bodies and Crayola bodies, these three things, charcoal laden crystals, Crayola bodies, and Cashman spirals, then you see it as asthma only. Okay, asthma, you can see three things: charcoal laden crystals, Cashman spirals, and Crayola bodies. Charcoal laden crystals, Crayola bodies, and Cashman spirals. Okay, so three things you can see in asthma. One is charcoal laden crystals, these crystals. Other is Cashman spirals and Crayola bodies. Now let's move on to the bronchiectasis. So bronchiectasis is very important. There is a chronic necrotizing infection causing abnormal permanent dilation of airway. This is a chronic necrotizing infection which is causing abnormal permanent dilatation of airways. Abnormal permanent dilation of the airways. Abnormal permanent dilation of airways due to chronic necrotizing infection. Due to chronic necrotizing infection, risk factors are Cartagener syndrome. Cartagener syndrome, it is a ciliary dysfunction. Okay, the cilia is not working properly. Cartagener syndrome. These most like in Turner syndrome, because here the female will be not fertile because the ovums are not catched by the cilia in the fallopian tubes. So Cartagener syndrome, cystic fibrosis, obstruction due to foreign body or tumor. Okay, necrotizing inflammation like TB, Staph aureus, allergobronchopulmonary, aspergillosis, fungal infection. Miscellaneous factors: rheumatoid arthritis and GVHD. So clinical features: there is a productive cough. Cough is so much. Cup full of sputum. Fever, clubbing, dyspnea. Left-sided basal involvement is more. Okay, diagnosis, if you see, there is a gross lung have dilated airways up to pleura. There is a dilated airways. HRCT shows honeycomb or tram track appearance. There is a honeycomb or tram track appearance. The HRCT shows honeycomb or tram track appearance. May develop secondary amyloidosis but does not lead to cancer. It is a benign condition. So honeycomb appearance, tram track appearance is the feature in HRCT. Um, grossly lungs have dilated airways up to pleura. Okay, so this was our first question. Let's move on to our next question. So see here, the next question is what is about different bronchiectasis? Bronchiectasis is chronic necrotizing infection into permanent dilatation of the airways. Idiopathogenesis, it occurs due to the uh, chronic infection like TB, Staph aureus, infections. Okay. Other thing is it can occur due to Cartagena syndrome, um, uh, and one ciliary disease, that is the Cartagena syndrome. um, cystic fibrosis. In cystic fibrosis, it can occur, or if there is a tumor or mass in the airways causing infection and necrotizing infections like TB, Staph aureus. Okay, morphology. In morphology, you will see in bronchiectasis, uh, tram track appearance, or you can say honeycomb appearance. Basal involvement is there. Clinical features: a cup full of sputum is there. Okay, wheezing sounds are there. Not wheezing sounds. So, complications. It is a benign condition. It can lead to this can lead to complications like um, it can lead to a benign condition. There's the irritation of bronch airways up to the pleura. Okay, define and classify pneumoconiasis, pathology, and complications of asbestosis. Pneumoconiasis, pathology, and complications of asbestosis. So this was about bronchiectasis. So short and sweet information seen in etiology, pathogenesis, carcinogenesis, cystic fibrosis, obstruction to foreign body, necrotizing infections, and miscellaneous rheumatoid arthritis. Talking about clinical features: productive cough, cup full of cough, sputum, fever, cupping, dyspnea, left-sided basal involvement is more. Diagnosis is by the gross lungs of dilated ways up to pleura. HRCT, honeycomb, or track appearance may develop secondary amyloidosis. Does not lead to cancer. It may develop to secondary amyloidosis. Talking about pneumoconiasis. Pneumoconiasis is very important. It is an occupational disease. So pneumoconiasis is an occupational disorder seen due to inhalation of dust particles, that is 1 to 5 micron, to macrophage activation and fibrosis. This causes restrictive lung disorder. Important examples include silicosis, asbestosis, coal workers pneumoconiasis, and textile work disease, that is Monday chest disease, and berylliosis. So pneumoconiasis is a restrictive lung disorder. If I ask you obstructive lung disorder, you will say bronchial asthma, bronchiectasis, chronic bronchitis. What else? I can tell about these diseases. But if I ask you restrictive lung disease, you have to talk about pneumoconiasis. Pneumoconiasis is an occupational disorder that occurs to the occupation of the patient due to inhalation of dust particles whose size is between 1 to 5 microns. They're into macrophage activation and fibrosis. Okay, examples include silicosis. Silicosis is also known as Grinder's disease or sand blasting or sand mining disease. Silicosis, it is also known as Grinder's disease or sand blasting or sand mining disease. So silicosis, it is also known as Grinder's disease or sand blasting or sand mining disease. Sun blasting or sand mining disease. So silicosis is known as Grinder's disease, sand blasting. It is related to sand, okay? So most common occupational disease due to inhalation of quartz. Quartz is a product of silica, okay? Upper lobes are affected. It is increased risk in TB or cancer. The risk increases for TB and cancer. Radiograph shows eggshell calcification. Eggshell calcification and bifringent crystals seen on polarized microscopy. So are the bifringent crystals on polarized and eggshell calcification can be seen. So radiograph shows eggshell calcification by fringent crystals on polarized light. So polarized light will tell you what type of material is there. Like bifringent crystals are there. It is because of inhalation of quartz. The silicosis, it is also known as Grinder's disease or sand mining disease or sand blasting disease. So most common occupational disease it is. It is due to inhalation of quartz. So upper lobes are affected, increased chances of TB or cancer. Radiograph shows eggshell calcification, and on polarized light you will find bifringent crystals. Okay, let's talk about asbestosis in detail. So asbestosis seen in workers engaged insulating insulation of plumbing industry. Seen in workers engaged in insulation of plumbing industry. So seen in workers engaged in insulation of plumbing industry. So it is seen in workers engaged in insulating or plumbing industry. So it is seen in workers associated with insulating or plumbing industry. Insulation or plumbing. Asbestos particles are of two types: serpentine and amphibole. Serpentine are curvy particles, these are less pathogenic. Amphibole are the straight particles, more pathogenic. Curved particles, these are less pathogenic. These are called serpentine, these are called amphibole. Amphibole, these are more harmful, more pathogenic. Following lesions are seen. Pleural plaque can be seen. Plaques are the most common lesion affects base of lungs as seen in image. Base of lungs is affected. Diffused interstitial fibrosis. So see, this is eggshell calcification. Calcification seen in silicosis. In asbestosis, most common lesion, pleural plaques can be seen affecting the base of the lungs. Base of the lungs, pleural plaques can be seen. Diffuse interstitial fibrosis have ferruginous body or asbestos body. See image. So in the image you can see they have the diffuse interstitial fibrosis is there. All fibrosis is there, has ferruginous body, and as or asbestos body can be seen. Increased risk of cancers, most common is bronchogenic carcinoma, most specific mesothelioma. Most common is bronchogenic carcinoma. Bronchogenic carcinoma. So pleural plaque most commonly affect base of lung, and diffuse interstitial fibrosis, ferruginous body, or asbestos body. Increased risk of cancers, most common in bronchogenic carcinoma and most specific mesothelioma. So in asbestos, you will see the pleural plaque, diffuse interstitial fibrosis, which has asbestos body or ferruginous body. Increased risk of cancers, most common bronchogenic and most specific mesothelioma. So once again, see about asbestosis. So asbestosis is the seen in workers engaged in insulation of plumbing industry. Asbestos particles are of two types: serpentine, which are less pathogenic, and amphibole, which are more pathogenic. Pleural plaque can be seen. Most common base of lungs is affected. Diffuse interstitial fibrosis, they have ferruginous or asbestos bodies. Increased risk of cancers, bronchogenic carcinoma, and mesothelioma. Coal workers pneumoconiasis. Coal workers pneumoconiasis. So associated with exposure to coal dust. It is associated with exposure to coal dust. It is associated with exposure to coal dust. It is associated with exposure to coal dust, may be asymptomatic, that is pulmonary anthracosis. So associated with exposure to coal dust, coal workers. So maybe asymptomatic pulmonary anthracosis, and symptomatic, that is simple coal workers pneumoconiosis, can cause central acinar emphysema. Central acinar emphysema. Complicated cases may develop progressive massive fibrosis. So coal workers pneumoconiosis, that is associated with exposure to dust. They may be asymptomatic. Pulmonary anthracosis or symptomatic. Simple coal worker pneumoconiosis can also cause central acinar emphysema. Complicated cases may develop progressive massive fibrosis. Because this coal dust, it causes massive fibrosis. Microscopically, they have dust cells, and grossly patient may have black lung, and microscopically dust cells and grossly black lung. Talking about byssinosis. Byssinosis is textile worker disease or Monday chest disease. Inflammation, inhalation of cotton dust particles causes byssinosis or textile worker disease. Kaplan syndrome is pneumoconiosis plus rheumatoid arthritis is seen. Kaplan syndrome, pneumoconiosis plus rheumatoid arthritis. Pneumoconiosis plus rheumatoid arthritis. Talking about berylliosis. Berylliosis is people in aerospace industry cause interstitial non-caseating in different organs with increased risk of cancer. Aerospace industry, interstitial fibrosis, non-caseating granuloma in different organs with increased risk of cancer. This was all about your pneumoconiosis. Okay, now let's talk about other thing, that is bone tumors classification, etiology, pathogenesis of bone tumors, osteogenic sarcoma, osteoclastoma, microscopy, Ewing sarcoma, osteochondroma, and gross microscopy.